Then you should see blinking green.
So you'll have to
Blinking green.
Blinking green.
Yeah, there you go.
I'm going to go ahead and get started with the afternoon session. Um, there are blue folders over on the table that have your district number on them. If you haven't had a chance to pick one up, please do so, and that way we can go ahead and start. I'm glad so many of you stuck around for the afternoon. I'm Kathy Dixon. I'm a account administrator at the Hutch Blue Cross Blue Shield office, regional office. And with me is Michelle Yingling. She is a group enrollment rep in our Hutch office. I think Stephanie Buckman will be here just in a little bit. And most of you are familiar with Stephanie. She's our regional manager now, but she's worked with ESDAC for many, many years and done these meetings for many years. So anyway, I'm glad you stayed for the afternoon. If you haven't finished eating, feel free to go ahead. This is going to be a very informal meeting, but you should all have your folders. And I'm also going to go ahead and start out a attendance sheet, because we want to make sure that we have everyone accounted for that did attend. Put your name and your district number, and it's really important that you give me that email address. And even if it hasn't changed, I use this to update my email contact list, and so put your email address down, and I'll double check it with what I have in my system. So I'm going to go ahead and start these around, and if you'll fill those out, and then I'll pick them up at the end of the meeting. There's also an outline of some of the topics we're going to go over. A lot of it is going to be geared towards our website and what you can find there on the website. The first sheet that I want to draw your attention to is this gold sheet. That's our who to contact for this plan year. I suggest that you keep that handy during their plan year so that you can access it whenever you need to either mail in, fax in, email, or need to give somebody a call with some questions. So we've got the mailing address, the membership fax number, the membership email. You'll notice that it's membership.ee. That EE in the address denotes that it's electronic enrollment, since all of our ESDAC groups are on Blues Enroll. And then there's the 800 number for customer service. That's the same customer service number that's on all of our members' cards. I encourage you strongly that when you have your employees come to you with questions about a benefit or a claim, that you refer them to the customer service number. That gets you out of the business of taking care of their healthcare business. And you're all familiar with HIPAA regulations, and so even if you were going to be kind-hearted and make that phone call for them, we could not talk to you about their claims or anything that's specific to their membership. So pass that on to your employees and have them make that customer service call. The next items are, these 6 individuals are actually your team of people that are assigned to work with the ESDAC groups. The first one is with Benefit Focus, and that's who handles your Blues Enroll. And so if you have any questions, make the phone call or fax, or you can send Melinda an email with your question. Our Blues Enroll person that works with for Blue Cross Blue Shield in Topeka, that's assigned to ESDAC, is Stephanie, and I don't know how to pronounce it, Manel. And that's her phone number, fax number, and her email address. So feel free if you have some Blues Enroll questions. If you've gone to Melinda and you need some additional assistance, feel free to email Stephanie, and she can address any issues or concerns you might have. We have Stacy as your e-billing contract. She's also with Blue Cross Blue Shield. Of course, Amanda Fox is your group auditor, and I think she's probably been the ESDAC auditor for several years, so you might be familiar with that name and with her. Melanie Hasselman is your financial auditor. So if you have any billing questions, Melanie is who you would refer those to. And of course, Mary Land is an ESDAC employee, and we'll talk a little bit more of what situation you would need to get a hold of Mary for, but this is her email address and her phone information. So those are the important people that you may need to contact during the plan year. Also, you probably want to add to this list your group, Blue Cross Blue Shield group rep, and that could be Bruce Schultz here in Hutch, or Michelle, or I know some of you may have someone out of the Wichita office, or Salina. But be sure you have that rep's name, phone number, and their account administrator written down as well. So if you have any questions, we're always there. Give us a call, and we'll take care of it, or we'll refer you to someone that can. So keep this this gold sheet close by. The next thing I think we'll do is we're going to go to our website, and hopefully you've all excuse me, are familiar with our website. It's got a little bit new look. It's fresher. It's more colorful, and I think it's kind of a neat look and a neat change. So first item that we're going to do is go to our group administrator manual. This is a really good resource for all of you. You need to remember that it is not specific. The information here is not specific to the ESDAC groups or any particular group. These are general guidelines that you can follow. But if you have a general question or concern, this is a good place to start. So if you go to the Group Administrator Manual, you'll notice on the left-hand side is the table of contents, and it's broken down by subject matter. And then as you click on each subject, there's a drop down, and it goes into a little bit more detail. I kind of put on the outline some of the subjects that we get a lot of calls on. So that's why we're not going to go through each one of these areas. But I do encourage you to take some time and get yourself familiar with the manual and how to find things. One thing that we get questions on is calculating the eligibility dates. Not all of you have a company-imposed waiting period. I believe there's some that have a 30-day company-imposed waiting period. And this gives you the formula as to how to calculate and figure in those company-imposed waiting periods and find out when your new employee will be eligible for coverage. The quickest and easiest way, however, is to just go to the enrollment eligibility date calculator. You input the length of the company-imposed waiting period, the employee hire date, and then show eligibility date, and that tells you when they're eligible, and also that drop dead date that they have to have their enrollment form, or you need to have the enrollment form input into Blues Enroll. That tells you that if you gave them the enrollment form and it's signed and submitted after that November 12th date, that's too late. They've missed their first opportunity to come onto the plan. So this is just a real quick, easy way to calculate that. And the next item is qualifying events. I might show you two on this page, and on each page on our on the Group Administrator Manual. On the right-hand side, there's also any forms access you can click on to any forms that would be applicable to that particular subject. So under qualifying events, you can access the enrollment form or a change form as well. We get several calls on different scenarios. Is this considered a qualifying event or not? This is a good chart that shows what would be considered a qualifying event. And what that means is that it's an event that has taken place that allows an employee or dependent to come onto the policy at some time other than open enrollment. So if you've got someone that's gets married, has a child, those are qualifying events for them to add that spouse or that newborn child. The effective date of the change or the enrollment is always the first of the month following the date of the qualifying event. The exceptions to that rule are newborn, adoption, or a discharge from military. So in those cases, the effective date is actually the date of the event. So if you have someone that had a baby today, then that baby's going to be added today. The important part is, though, in newborns, is that be sure and have your member go ahead and complete a change form to add the newborn. A lot of times, particularly in instances where they may already have a family policy, the assumption is made that, well, when the claim comes in from the hospital, that baby's going to be added, they have a family, no big deal. Well, unless they do a change form, the child is not going to automatically be added. So you need to have the change form done, and you need to enter that newborn into the Blues Enroll system. Oh, yes. Mm-hmm.
We're going to have to do this with our bus drivers, and we have to do this measurement period. It's not always going to fall. We're going to be looking at
Thank you, Carol. Question was, excuse me. Okay. How, with the measurement period and stability period and all of that, at what point when you guys determine that somebody's eligible after you've looked back that 12 months, how will we, Blue Cross, be able to put them on and the time period and 60 days and all of that, all of our requirements? It's a very good question because we don't have any guidelines per se to date that I'm aware of, and I just kind of transitioned from that role into this role, so I'm a little bit in the dark. I know it's something we're looking at, and Carol and I were just talking about that, where now the application has the hire date on it, and it may end up being, from what I understand internally, is that it would be effective date. So we're not going to ask questions as to, you know, what time period, what look back, how do they become eligible, just what is the effective date that they're eligible. Now, I can't promise, I can't see necessarily exactly what we're going to do, but it's my understanding we're not going to ask all groups what their measurement, their different administrative measurement stability period is to keep in our system. So more to come on that, and I know we were also talking with all groups being in Blues Enroll. It's almost a little bit more difficult when you have odd scenarios to get those in because they don't always fit the mold. So more to come as we determine how all of that will be handled. We'll probably streamline it through the monthly SDAC meetings to keep them on top of that. So.
Well, and it almost sounds like, particularly with Blues Enroll groups, we rely on the groups inputting that information, that if the event date is that it is what you input, then that's what it is. We don't go back and police that or police the groups to verify that information. So it's going to be what you tell us it is. But we're going to have to figure out what what our procedure is going to be on our end, it sounds like. So more to come. Are there any other questions with regard to that? Anything about qualifying events? Oh, yeah.
One of the qualifying events I'm hearing a lot is because of the healthcare reform laws, other employers are making changes to their plans, or changing the costs, or determining their spouses aren't eligible. What kind of event, when the district's employee's spouse works somewhere else, is there open, and is the spouse's employer's open enrollment changes an opportunity for them to come on the district plan, even though it might not be the district's open enrollment?
The history has been that if your spouse is having open enrollment, depending upon what that change is, that is not a qualifying event, because what's happened in the past is that couples have had to take that into account, and either they would have duplicate coverage or they would take that risk of not being covered until open enrollment period. Now, Michelle and I were talking about this earlier on this morning when he was talking about not covering spouses. Now, whether or not that would be considered, if you're the other employer is saying we're not any longer going to offer coverage for the spouse, whether that would be considered a qualifying event as loss of coverage. Spouse's employer no longer offers coverage, and before, you know, we've had some come across saying that, and this has been kind of a gradual thing, that, well, my husband's employer, yeah, they'll offer me coverage, but I have to pay a extra for it. You know, they're going to charge me an extra $100 a month. Well, that in the past has not been considered a qualifying event because it is indeed, they are offered coverage. They are still eligible to be on their spouse's coverage, so it's not a loss of coverage. But this is transitioning into another step further where they may not even be offering coverage to the spouse. And to tell you the truth, I'm not sure what that would be considered a qualifying event and fall under number 4 or not.
But we still kind of need to work from the guidelines. Just because Section 125 says it's a qualifying event does not mean Blue Cross and Blue Shield says it's a
That's
qualifying
correct. And that's one thing I've always cautioned when we get these calls is you need to make sure that it's a qualifying event on your Section 125. You can't just assume that you can make that change. Yes.
I asked you that question last year because I had 4 people who came to me in December and told me they were losing coverage on their husbands. And what I was told at the time last year was that if they actually were losing their coverage, it was qualifying. But if they were going to just have to pay a premium, it's not. And so that's what I told them. But how do you police that? How do you know
Well,
what's being offered?
you don't really ever know unless you're going to police that.
That's really interesting.
You can ask for a letter from their prior employer explaining the
From
situation.
the husband's employer, because it was all of them were spouses that were losing coverage. Or supposed to.
Yeah, yeah. But unless you're going to police that, and I guess referring to my earlier comment, if you have an employee that comes to you and says that, and we're not going to ask for that proof of loss of coverage. Blue Cross Blue Shield is not.
We did have a group here that did do that, and they supplied letters to those spouses that were on anyhow, so most likely that's probably a way that they're communicating that to them. So.
And I've actually had inquiries from the spouse's coverage who say if they're eligible, we're going to drop them. So I've seen those inquiries come.
Yes, so if they're eligible for other coverage. Oh, okay, the comment was that if they are eligible, there are other employers that are saying if they're eligible for coverage, then they're dropping the spouse. And so, I mean, that's something that would be, I guess, proof. I'm assuming they're communicating that through letter or something. If they bring that to you, that's proof that they are indeed losing coverage, which would then be a qualifying event. Any other questions or comments? Okay, the next topic we're going to highlight is when you remove insureds. And this has become increasingly important because there are no retro cancellations allowed. So it's very important that if you've got an employee that's terminating employment, that you get that entered into Blues Enroll, and that's important for several reasons. Obviously because we don't allow retro cancellations any longer, but also it allows for you to offer them that COBRA, that COBRA election in that timely manner, because you have a certain period of time in which to make that offer to them, and you need to do that within 2 weeks. And so it's important that you just take care of the termination process all at once and get them terminated in Blues Enroll. That needs to be done no later than the month in which the change occurs. So if they terminate employment today, you need to get that entered in the month of August. And that also is going to make sure that it is taken care of on your bill so that you have the most current bill the next cycle. Obviously, it makes a difference as to where you are in the billing cycle and so forth when that happens. But the sooner you get those terminations in, the sooner you're going to have a bill that's been adjusted correctly and so forth, which brings me to the next subject of the billing statement.
Do you want to, before you go on, do you
Yeah.
want to hit on the teachers, the contract, just as a reminder that they go through the end of the contract?
Oh, yes, this, good point. Michelle brought up the question about teachers that are under contract. There's always a lot of questions about if you've got a teacher, they're not physically there teaching past the month of May, generally. When is their coverage over? It is at the end of their contract period. So if their contract runs through the end of July, then they're still eligible for coverage through that contract period. So their coverage would end August 1st. Is there any questions or comments about that? Okay. The billing statement, again, this refers back to terminating your employees in Blues and Roll so that your billing statement gets reconciled and adjusted. It's very important that you verify your monthly bill each month to your current enrollment records. Not only does that guarantee that you're paying the right amount in premium, but also it gives you an opportunity to catch any changes that may have happened during the month since your last billing period. So it's just a good double check for you, so that if you can catch it and it's not 2 months or 3 months down the line and we have to say, I'm sorry, we can't go back 2 or 3 months to cancel that member. So be sure and verify that billing statement. When you do have questions about your bill, the individual that you would need to call is your financial auditor and the name on the gold sheet. So that's your contact person for any billing questions. Okay. Medicare eligible, this is another area that comes up often, is when you have someone that's turning 65, and in this context we're referring to those, what is called the working aged, so they're continuing to be an active employee. And of course when they turn 65 they're eligible for Medicare. And they would automatically get Medicare Part A, which is the hospitalization side of Medicare. Because in groups of over 20 active employees, and I believe all of the SDAC groups are, that gives those active employees the option of either staying on their group as group primary, and in that scenario they would only need to have their Medicare A, and they would have their group as primary payer. Or they can choose to have Medicare as their primary payer. If they choose that option, then it would be necessary for them to also get Medicare Part B and Medicare D, which is the prescription drug benefit for Medicare. If they choose Medicare as primary, they no longer can remain on your group coverage. So they would come off of the group coverage and more than likely transition over to a Plan 65 supplement to Medicare. Now it's important to know though, if they decide to do that, that's not an automatic thing. I mean, they don't, you take them off of the plan because they've chosen Medicare as primary, we don't automatically transfer them to a Plan 65. But they can contact the Topeka office and get a packet for Plan 65, or you can contact your field representative's office. We'll get their information, make sure they have a Plan 65 packet sent to them that includes an application, and we can walk them through that and make sure that they get enrolled in a supplement. In order to have that supplement, however, they need to have Medicare A and B. So are there any questions about Medicare eligibility? And then as you go further down in the table of contents and click on forms, this is a place where you can also access various forms, the enrollment form, change forms, HIPAA designations, and so forth. So there's several different areas on the website where you can access these forms. But the group administrator is just one area, but if you click on that, it shows you what the forms look like, and you can pull from there. So if there are any other questions, I think we'll go back to the forms and manuals section. Just get out of the group administrator manual. Maybe. Or not. There we go. And we'll go to forms and manuals. Okay, you can access the group administrator manual from this page as well. You can go to the enrollment eligibility calculator, which we referred to earlier. Also, this is where you find the new hire checklist. I've put in your packets the new hire checklist, and then I've printed those forms that are included. I might say that when you need to pull forms to give your new hires, or whenever, if you're needing a form, rather than stockpiling them up, which is probably a lot, may be handier for you to already have them in a packet ready to go. But I encourage you to go to the website and pull the forms right from the website. Those are going to be the most up-to-date. If there's any changes made to the forms, that's where you're going to find them. That way you're guaranteed that you're not using an older version of the forms. Where's the new? Here we are, up top. So there's your new hire checklist. I'm not really going to go through all of these forms, but on the new hire checklist, there's links to each one of the forms. So you can just go to the link and pull it up and print it off. Also, there's the employee termination checklist. And both of these checklists are good to have and literally check off to make sure and keep in their personnel file, make sure that you've given the employees everything they need when they're first hired, as well as when they terminate employment with you. And so there's the termination checklist. Some of these items may not apply to your group. Obviously, you utilize those that do. And there's copies of those forms with your packet as well. And then there's the government mandate sheet. I did not print all of copies of these because some of these are would be duplication of either new hire or termination. But here's the list of notices that are mandated or government mandated. Yes?
You mentioned the model notice of the grandfather plan.
That's just right now.
That's not one I'm familiar with. Is that part of, is that sheet that we get?
That the question was the grandfathered notice. I can't think of It was mentioned this morning that that's a requirement for all groups to send out, along with the women's breast cancer notice rights, women's rights of the breast cancer. Both of those pieces are included in the member contract. So the grandfather notice, I believe, is the cover letter saying you are a grandfather plan, and then I believe the woman's cancer rights is the first page of the actual contract underneath their information. So we take care of that.
So subject to possible chill and they get the tax.
Yes.
Yep, questions? This just popped into my head. One of the questions I had from one of the groups yesterday was about the pre-existing condition, the notice in their new hire packets. As you know, the pre-existing does go away with your on anniversary, October 1. However, for school districts, I know a lot of you have new hires that are coming in that were hired in August that may be enrolling at their first opportunity if you don't have a company imposed waiting period for a September 1. So it is necessary that you go ahead and get their certificate of credible coverage from them, and that those be submitted just as they always have, because we would apply that credit to them for that 30 days that they'd be on in September, that they may be able to waive that pre-X. So you still need to continue to do that, but then October 1, that pre-X will go away. Yes?
We probably need to do that though if they're moving from one group within our ESDAC plan to another.
That's correct. If they're moving from one ESDAC group to another, you wouldn't need to. It's Blue Cross Blue Shield of Kansas. So we now, because except for on their enrollment form, it asks for their current Blue Cross Blue Shield number, and that's how we've always been able to do that. What do we do with Blues Enroll?
I think isn't that what goes through Maryland? She has that.
Okay, so she has that, right. Right, okay. So Mary Land would actually do the transfer, and that brings us to when the instance where you would need to contact Mary is that if you have a employee that's coming from another ESDAC group, if you contact Mary, she can make that transfer, and that would then take care of that pre-X issue.
They might also let those folks know that they're from one ESDAC, one district to another in the ESDAC. You remember, right, we had the issue of the little fellow that went from one, from that number, so ours, he thought his deductible period was changing, and it actually stayed the same, so he financially kind of got himself in a mess because his deductible period had not changed. He thought it had changed, and
You mean its benefit period?
no, deductible. His deductible was like July, and he thought since he was coming up in October that his deductible period would be October now.
And it remains.
And it remained for July.
Because it was still the same membership. Yes,
Kathy, would you repeat that question for the?
I'm sorry. Forget. The comment was that if you've got someone that's moving from one ESDAC group to another, that the benefit period would remain the same. That they don't start over on their benefit period when they join the new group. Yes. Yes. Their deductible year, that would be for contract benefit period. If they were in the group, in a group going from a contract benefit period.
After the pre-existing condition exclusion, there's 2 blanks in there. Those, what do we put in there? So 30, I heard you mention 30 days. Is that what you put in there?
Well, the 30 days would be, what I'm talking about is that because SDAC, we do a 90-day look back. Let me see.
Getting ready to do one the other day, and it had 2 blanks, and I didn't know what it was.
Just a minute. Let me take a look and see what you're referring to.
I don't know if it's something that I had a copy of the web.
Yeah. Michelle can pull one up on the website.
Maybe I can't get it to scroll down. It's not coming up on the side or anything. Now it is. There. It's being silly. Okay.
Oh, well, should be, yeah, there.
Would be you might have to wait 30 days.
30 days before this plan.
And it would be
Right, that's making the assumption that
Right.
they're starting 9/1 effective date.
Apply a 90-day pre-existing waiting period to them as of September 1, and then we're gonna take it off as
It's-
of October 1. Or take it off if they provide but I think it still needs to be the same as it always has been. You might have to wait 9 days, but because of the situation, nobody's gonna have to do that.
So they would both then be 90 days.
Right.
Both. Yeah, blanks.
Okay. Yeah. Okay. Also on this page, in the second paragraph, you'll see that there's a link to the CMS Credible Coverage Disclosure site. Oh. And it's not there? If you bring that up, it takes you to CMS. And as you know, that's still a requirement that within 30 days of your renewal date of 10/1, you need to go into the CMS site and make that disclosure to CMS as to how many employees that you have that are eligible, Medicare eligible. And automatically our brains go to they're 65 years old. That can also mean that they may have a disability and they're Medicare eligible for a disability, or their spouse or their dependent is. So you need to take those into account, as well as giving the notice, the CMS notice, to those employees that are Medicare eligible. And that needs to be done within 30 days of your renewal. But this is the site where you would need to make those disclosures. Also on this page, you can go in and access to make an address change, order an ID card. They wouldn't do that because you do that in Blues and Roll. But if you have an ID card that needs to be ordered, for some reason in the last 30 days, everyone's lost their ID cards. I bet I'd ordered more ID cards. I don't know what's going on. That's where you can make those changes. And then as you go down, there's miscellaneous forms, and that's where you would access some of the forms, or all the forms that we're referring to. Again, I would encourage you to use the forms, access the forms on our website to get the most up to date. This authorization for release of protected health information, the first one on the list, if you have a member that's wanting to have their spouse have access to their membership, or if they want access to a adult dependents information, this is the form that they would need to complete and submit to Blue Cross Blue Shield, so that if they called with questions or had any concerns about a membership or claim, we would be able to talk to them. So that's a HIPAA form. Yes, your college student or whatever. So that's that's the form they would need for that. So then if you go back to, I was going to go to the e-billing login page under employer. This is where you go in and log in to your e-billing account. Most of you are all familiar with that. We're just going to kind of navigate through some of these so that you're probably familiar with where to find these things. But and you can download the user guide if you need to do that, or just bring it up if you had any questions that it might address. And then also, if you go back to the employer, this is where you can go into Blues Enroll. And in your folder, there's I think I made a blue sheet that says special notice. Those are your Blues Enroll timeline. We were anticipating that you would actually be locked out of Blues Enroll for the rest of this week, and that you'd start your open enrollment period on the 25th. Yesterday we learned that they got in and out and got everything configured a little faster than we thought. So Blues Enroll is now open, so you can input your open enrollment changes now. That the drop dead date on having that done is the 5th of September, which is what we had originally thought it would be. So you need to have all those changes input by the 5th of September. That will allow us to have your billing out there in e-billing by the 19th of September. That also will allow us to get your new cards and so forth out to everyone before your plan year starts. And then we'll go through the usual verification report after that initial billing comes out to make sure that we got that everything is as it should be. One thing one thing I would recommend that you do in Blues Enroll is to run that benefit detail report after you've input your open enrollment changes. That will be a good double check for you to make sure that you got everything in and changed the way it should be. If you do that at that time, it will cut down and save you time later. I guarantee you, if you catch it then at that time, rather than after that first billing comes out and we do the verification report and you find out, I didn't get someone changed, I didn't get an option changed, I didn't get a dependent added, or something like that, and we need to then go through the exception process. So if you take the time to run that report now, that would be very helpful to both you and the member and to us. Again, when you're moving from one SDAC group to another, you need to contact Mary Land. Also, questions sometimes comes up as to how to move an employee, an active employee, to the retiree group. All the SDAC groups have a separate retiree group, and there is a step-by-step in Blues Enroll. I've added this into your packet too that shows you that process and how to accomplish that. With Blues Enroll and Benefit Focus, if you have any questions, again, Melanie is your contact person, and her contact information is on that sheet. So give her a call or shoot her an email if you get hung up with something, and she can help you with that. That's what she's there for. She's assigned to help the SDAC groups, so don't hesitate to pick up the phone or to give her to shoot her an email. Are there any questions about the website or anything like that?
Question.
Yeah.
On the website, they have the how-to and I can view. And then when I get it, I have to download it into iTunes, and I can't pull that in iTunes. Is there another way to do that?
Okay, I've got the question about the how-tos on our website, and you're getting,
Well, when I click on it, it says download it, and then it will download into my iTunes. And I don't know.
she's saying that it asks, request it to be downloaded, and it downloads it to iTunes.
Are you doing that on a Mac or an iPad?
Nope, just want that, but so just my,
Because that's what my iPad does that when I'm trying to pull up like or something like that.
and then I download it, but then when I put it on iTunes, it doesn't show. I don't know how else. I've got my IT guy on it, but he said it's not our issue.
And is it on Blues and Roll or is it on our website? Okay.
So it's on Blues and Roll. Well, then that's something we need to check. Is anybody else having an issue with that? You're special. Well, we'll check that, and we may need to check with Blues and Roll and see if it's something on their side. Yes?
If you have an employee retire and then come back full time, should you move them back to the employee billing, or you want retiree billing? I never quite what to do with that.
So they're becoming an active employee then, again. The question was if you've got an active employee that retires and have been moved to the retiree group and then they come back to work, do they get moved back to the active group? And I would say yes, they need to be moved back to the active group.
We leave them on retiree with 5 years of age 65, and of course they can stay on till 65. You were jeopardizing moving them back to retiree when they quit, because there's no actual retirement of that.
Yeah, it's hard because they retire with cases, so we think they're retiree, everyone's retiree. Then they come back to work full time. So when they retire, you put them on the retiree group. Come back and start working for you then.
But they real,
Retiree group.
Marcia, you're talking under 65 retirees, right?
yeah.
Under 65.
So you're talking about an early retiree. Okay. I think they need to go back to the active group.
Julie, did you say you leave them on the retiree bill?
Yeah, we've left them on the retiree group.
Pointed that out.
But if they turn 65, then they lose their insurance. Yeah. Whereas if you put them back on the regular, they keep getting it until they're 105. They still work.
Yeah, that's right.
Yes, as long as they're an active employee, they should be on the regular group, whether they're 65 or not.
But if all this happens before they turn 65, you're giving them back to the retiree billing?
That's right.
If they're under 65.
Yes, as long if they meet those requirements. Is there anything else? I also, if there's not anything else with the website or forms and so forth, I also provided a flyer about the foundation that says Foundation Renews Healthy Habits School Grant. This is the Blue Cross Blue Shield of Kansas Foundation, and it's a school grant program. They're starting their 9th year, and they're now starting the application process. And you can find that application by going to About Us on our homepage and under the Blue Cross Blue Shield Foundation. And then there's the Healthy Habits for Life. And that gives a little bit of a summary, and then the application you can actually apply online. I have gotten, do have some paper applications here, so if any of you are interested, in that program and applying, you can get a paper application from me, or like I say, you can apply online. It might be interesting to know that that deadline for the application is October the 10th of this year, and then they award the grants in mid-December. And so we did have 6 groups that were SDAC groups that got grants last year. They were 313 Bueller at Prairie Hills Middle School, 376 in Sterling at Sterling Grade, 401 Chase, the Chase High School and Raymond Junior High, 444 Little River, their junior and senior high, 349 Stafford, and 350 St. John, their elementary. So these grants are awarded. There's money out there for them to use, and what this is geared toward is improving the overall health of school-age children. And so I think it's a fairly easy application process, and there have been it says $718,000 in the last 8 years have been awarded to school districts for this grant program. So it's well worth the time to make the application and go for the grant award money. Yes.
It says in here that it's to one per school. Are you talking school district, or are you talking like an elementary school could apply and so could the junior senior high?
Well, I noticed that in the, Stephanie, do you know that?
I'm sorry, we were talking.
Oh. Is it per school district? Or, because I noticed on the award, like in Chase, the Chase High School got it and Raymond Junior High. So there were 2 different schools.
And I've noticed Bueller has separated out between their schools too.
So it may be the way the grant the application is made.
I think as the years have gone along, I think you've found out ways to maybe maximize the organization.
Right. So I think that's all I had, and then Michelle was going to go through some information on our healthy options and the SBC, summary of benefits and coverage.
I know about the time that we were doing our SDAC renewal meetings, we were talking about how our resource blue was changing to healthy options. We finally have that piece, and for a lot of you that have had employee meetings, this is being included in the employee meeting packets. And this is just a reminder, this is our value added. We sell the sizzle is what we call it, because it's this part of the Blue Cross and Blue Shield is not necessarily included in the insurance benefits. It's just a benefit to the members for having Blue Cross. We have on our healthy options, there's the disease management program. It's the 6 chronic conditions, and forgive me because I probably can't name them all, but COPD, heart disease, high blood pressure, diabetes, hypertension, and high cholesterol, and then is it depression, or it's mental health maybe is the other. But what it is it's a program that any member can opt into. We send out flyers regularly to those that we've determined have one of these 6 chronic conditions, asking if they want to opt into the program. We have nurses on staff in the evening. We've gotten some of them to where they're working from home, so it's even easier for us to work with our staff as well as all of our members. But they called the employees or members opt in to the program, and they get called however often is needed, whether it be once a month, twice a week, in the evening when it's convenient for the member to talk about those chronic conditions, making sure that they're adhering to their doctor's plan. If they have questions, you know, you think of diabetes, it's a lifestyle change once you're diagnosed with that. A lot of questions, a lot of dietitian meetings, doctors, you know, depending on what it is, whether it's injectables or pills. But sometimes there's, with the change of diet and all of that, there's a lot of changes the first few months or even year of being diagnosed, that this is something that would help our members take care of themselves better and have a better understanding and feel like they have somebody to reach out to versus having to call their doctor during the workday on their time at work, as well as trying to get a hold of a doctor during the day. So I just want everyone to know that those benefits are out there to anybody that's a member. And all you have to do is, if you click on the health and wellness, or there, yeah, I guess either way, the disease management down here at the corner, in the corner, and then it gives a phone number, I believe somewhere, email.
Here it is, right in the center.
Okay, yeah. That all they have to do is call and opt into that program or send an email. But this kind of is an overview too if you have somebody that has questions, which, you know, I know we normally don't want to know what is going on with our members, but sometimes if they ask, I've just been diagnosed with this, can you tell me what my plan covers? They can reach out to the care management as well, or disease management, sorry, that's just changed, and ask them those questions, and they will let them know what our plan covers for their situation as well. So you'll notice WebMD is on here next, and we've partnered with them, WebMD. I know some of the hot topics lately are the wellness programs and that sort of thing. But WebMD offers a health risk assessment. We have several groups that utilize that health risk assessment for their wellness programs. So employees can go out and fill that out after they've taken their biometrics and that sort of thing. So keeping in mind, if you're going to start a wellness program, we do have tools to help with that, as well as our disease management staff. They always like to help any way we can versus you guys ever going out and hiring an outside company. We have tools to help you with that. But there's also like a goal setter on the WebMD. There's a electronic health record. There's several different tools just within WebMD itself that is value added to the member. The big one, or I say the big one, the one that I like the most, is the Blue 365, and that's our weekly, well, you have to sign up now for the weekly deals, but it's our health and wellness vendors that participate in a discount program where you can go out and you can get discount on vision, anywhere from 10 to 40% off of lenses, frames, contact lenses. You go on to, you have to sign into Blue Access for all of these, which Blue Access login is right up there to get to any of these pieces. But once you sign in, you just click on the information. I'm sorry I'd sign in, but now it has everything right up front, which is nice, but not when you want to show people. But you just log into that, and then to get started, if you haven't been in there before, it now requires you to do the weekly deals, and you'll get a email about once a week, not necessarily on the dot or anything, but it gives a wide array of deals. We have our regular vendors that are on there that you can search through. There's, like I said, the vision, LASIK eye surgery, hearing aid, Reebok, Jenny Craig. There's some fitness, like one that is a membership that you can have if you sign up, and you can go to certain gyms within that vendor. Like the YMCA of Hutchinson is one of those where you pay $25 to this vendor, and then if you travel a lot, you can go to other facilities within the state or within anywhere that has coverage. So there's a wide array of those, and I always like to point out summertime, I've seen a lot of hotel discounts. I've seen tax time. There's tax programs, savings on, like, discounts on the tax program. So it doesn't necessarily mean it's just limited to what's out there, but it's nice to know that you can receive discounts for services that aren't necessarily provided in your health insurance, like the LASIK eye surgery, the lenses, the frames, and then, hearing aids, that sort of thing. So, but the key of it is that if you utilize those services, you have to log in and get that information prior to using it. So like with the vision discount, there's a code. You take that code to the participating provider to get that discount. For LASIK eye surgery, you just go through that vendor, you call and schedule the appointment with them. You don't go necessarily to a LASIK eye specialist and schedule it with them. You go through the process of working through that vendor to receive that discount. But there are some pretty significant discounts available. So we are mailing these out with all of our contracts. So as your employees get new packets, they'll receive this. But as a reminder, as I've done employee meetings, I've been going over this information. But if you have new employees, you might point that out, or as you do your new orientation, which I know some of you are already done with that, luckily. So any questions on that? Last but not least, I'll go through everyone's favorite, SBCs. In our renewal packets, I don't know if every rep had given this out or not during this last renewal. I know the previous renewal we had this nice little pamphlet that we handed out. And this is just a reminder, it's an overview explaining why we have the SBC, which we kind of briefly discussed this morning. It's a standardized format for all carriers to provide a general comparison of benefits. So this is just a sample of what those are, and then this is the part that's important to keep track of. So the top part just describes who gets these. The second one is timeframes for Blue Cross and Blue Shield to provide these to the group, and there's 2 times that we do generally new business, which is not necessarily any of you guys, but at renewal. So we provide these as soon as you make a determination, which with SDAC, pretty much that was determined right off. So we had delivered these according to what your grandfather status was, because there is one for grandfathered and there is one for non-grandfathered, and that means one for each option. So we did provide those at renewal. If you needed them electronically, generally the rep should have been notifying them because we had handed out hard copies, and then upon request. So if you were to need one of those, we would have 7 days to get those to you, and I know that Deb's going to go over that they're online and where they're at on the SDAC site here shortly. But you will get those every year from us as we complete renewal, so that does not go away. Then the last part, the last little section here, is timeframes for groups providing SBCs to employees and dependents. So the first bullet is initial enrollment, and all of these should be included in your new hire packet. All 3 options need to be included in your enrollment packet so they know what their options are, so they can compare to what they currently have or what they're shopping for. Then during the renewal, it says SBC should be provided when renewal materials are delivered no later than 30 days prior to the group's renewal date. So it's important that when you send out all of the renewal information to your employees, you're including these. It's for all eligible employees. It's not necessarily just those that are enrolled, so it's important that you give it to everyone who is eligible. For those that are enrolled in a plan, you only have to give them that option. And for those that are eligible that aren't enrolled, you would need to give all 3. I know we briefly talked about putting them online or emailing them, and the notification that you're required to give electronic notification if you post them, or a postcard per se, notifying them that it's out on your site, or I know a lot of groups were just emailing them out to all of their employees, all 3 of them, because in a lot of ways that's cost saving for paper. And then special enrollment, so that would be somebody who has a qualifying event. So if they have somebody coming onto their plan, a spouse, a new marriage, or adding a child, that sort of thing, you would want to give them an SBC. And just so you're aware, it does say that there's 90 days, but anytime they make a change in their plan, we do send that out from Blue Cross just in case you forget to give it to them at that time. Not to say that I wouldn't want you to give it to them, but we do cover that aspect of it. And then if the member asks, you have 7 business days to get that to them if they ask you for an SBC. So just as a reminder. Does anybody have any questions on that? No? If you do not or did not receive these at your renewal and need them, want them hard copy, which I know they're going to be on the ESDAC website, and like I said, Deb's going to tell you. But if you do need these, please let us know. All you have to do is call your rep or Kathy, but your rep should be able to provide that fairly quickly electronically within that day. So, all right, I think we're done. So, did you want to come up, Deb? Okay. Does anybody have any general questions other than that about Blue Cross? No, we've kind of.
Well, it's not really rocket science, but I thought it might be helpful if you just knew where to look on the website to find that. We will be sending the link out as well. It looks like rocket science right now, doesn't it? Must have a loose cable or something. Yeah, if you could hold it just like that and like stand on one foot and so just to that's kind of probably how you feel today after this morning and this afternoon and everything, isn't it? It did that earlier and then it kind of quit, so loose cord. Well, I'll take you through it. It's not that difficult to find. On the top of our menu at the top, you'll see that services is right there in the middle. And at the very bottom is more. And then we have district and employee benefits. I'm going to let it sit there for just a minute so your eyes can maybe adjust to that. That is quite annoying, isn't it? I'm going to try one little thing here and see if we can. Better, right? That gives me a headache. That didn't make any difference. Okay. If you go to the employee benefits, you'll notice that there is a Blue Cross Blue Shield option on the side. And one of the things I'll probably ask them to change is that you'll see it says Summary of Benefits and Coverage 2014. I'll make that 2014-2015 because you and I probably thinking that's fiscal year 13-14 and it could be confusing. But it is at the top there, and you'll notice that that there is one for each of the grandfathered and non-grandfathered options, and you can print it from there as well. They're PDFs and easy to access. So in whatever way it's easiest for you to get it out to your employees, that's where you go to find it if you start at our homepage. We can send you a direct link for that as well. Okay. Any other comments or questions or thoughts or anything before I give it to Carol to kind of wrap up with one last question? And there's plenty of snacks over here yet too, so. Okay, Carol.
Don't anybody pull the non-grandfathered SBCs. Just use the grandfathered, not in this room. Okay. All right, so what are your thoughts? Oh, let me get more specific. Yeah. Let me get my notepad. Yeah. 7-1 versus 8-1. Yeah, let's pin that down. We're doing this with only your variable hour employees. Yes, Marcia?
If we started, where are we begin to start? See, our payroll periods are not anywhere exactly the same.
And in any district. Oh, sorry. We all know our payroll periods are not going to be the same in any district. Like, for instance, my payroll period for September that I'm going to pay them is for August 10th through September 12th or whatever. So how do we determine, when you say 8-1, if we're going to go from 8-1, how do we determine, is that what we're going to pay them in August? Is it going to, because that would cover 8-1. It'd be July, it would have been July to August 9th.
That is a question that we asked to Brian. Let me see if I can find it.
I just didn't see that.
No, I know. I haven't gotten all the way through his responses either, but I was quickly looking at it. The law does allow you to consistently use your payroll period if that makes sense. Number 6.
August 1st might be over here on a Friday, and you're paying through the 8th or whatever, but then you just use August 1st then, and that way you can start just each week at a time. I don't think it matters what you say then.
Dawn suggests separating the fact of actual hours work versus pay.
Well, but see, my actual hours worked are from August 10th to September 12th. Those are my actual hours worked, but I don't pay them into September. I didn't know if I was supposed to be tracking from August 1 to August 31st, or if I could track my whole payroll period. That's how I've been doing it.
The law does allow you to use payroll periods, and
Okay.
they gave an example of a calendar year, and I think it's in the answer on number 7. But we can always work into our August year if we need to, or our July year. It says if you look at a calendar year, which includes January 1 and December 31st, only one of your pay periods can include one of those dates. You can't have pay periods that overlap both dates, because that would be longer than 12 months. So you're overlapping, and if we just replace August with January and July 31st with 12/31 and move that, back, you wouldn't use the pay period that overlapped and included August 1, but you would use the pay period that overlapped July 31st of the following year. Does that make sense?
Mm-hmm.
Are you finding that your payroll software vendors are going to be there with tracking systems? Some yes, I see some no's. So those systems should be able to separate by date and go either with an August one or a July one, you would think.
Is anyone using a particular tracking system now?
Anybody want to throw out their payroll vendors' names that they know they're going to receive assistance from their payroll vendor? Pardon? Attendance Enterprise with Harris. And they say they are going to get you ready and help you track. It's a reporting that interfaces with payroll time clock system. Okay, anybody else? Any particular spreadsheets that they're using? I don't.
I just made one up on Excel and did it by week, and then on my front part, it's like, they're by week, so it's just whatever hours worked that week for that person.
Donna's using a Excel spreadsheet she created on her own from Cheney. It's tracked by week. Does it have to be weekly or monthly? You have the choice. You can use 130 hours a month, or you can use 30 a week, because it ends up being the averaging over the 12-month measurement period. If we back this up to July 1, we have to put a 90-day open enrollment period in. And an initial new person is going to have a different. We can't use 12 months then 90 on a new person. In fact, you can only use 12 months and 30 days because you have to offer effective the 14th month for a new person. Yes. But we're talking about the ongoing, what we'll do for open enrollment every year, not just what a new person would have to go through. Now, you initially had told us to tell you what the measurement period was going to be. I don't have to tell you. So if you wanted to adopt one that matches your payroll period, but then you're going to be labeling that differently every year.
So we can do our own thing?
You can always.
I mean, is that what you're saying? We as an ASDEC group want to do it all together, all the same.
Well, we've never mandated how you define who's eligible.
Would it be safe to say that consistency is the most important thing?
Oh, absolutely. Within your own district, consistency is most important. Plus, you know, in big picture, we're not wanting to give away the farm to someone who's not eligible. Yeah, I mean, we're looking to protect our pool. And so we don't want, you know, extreme eligibility definitions. But I don't know that I have the authority to say you can do your own thing. I think that we'd want to run that by the committee before we said, go ahead and pick your own measurement period, stability period. We know the stability period is always going to be our plan year.
I think the thought had been on trying to establish. I think the thought had been on trying to establish one period for everybody, just that when we have meetings like this, it wouldn't be, well, it depends. Don't know yours, don't know yours, don't know yours. That we could say, here's the period, at least in terms of generally when we're starting.
Yeah.
That's just why I thought July 1, everybody begins their fiscal year July 1. It's a common date,
Okay.
commonality. And
So for consistency, we have a July 1 put on the table. All in favor? Let's just take some feedback. Is there anybody that would prefer July versus August? Is there those who really don't care, who doesn't really care? So if you don't care, or you'd rather have July, no, let's do it the other way around. Anybody want to have August 1st? Okay. Is there any reason? Roses at the South Central Kansas Education Co-op, their contracts start in August and people start working in August. So that'd be the first time you'd actually see some hours showing for that person. And since, you know, if, well, yes, there is. All right, so Dawn's saying, since we'd have to estimate what their hours would have been in July, it would almost be more difficult to use a July. So you'd wait till the end of the, towards the end of the 12-month period to go back and calculate what their average hours have been since they actually started working, and then apply that to the month of July, which was the first of the 12 months, to get your average. And you'd rather do that, go back and throw an average in July, than start when they're actually physically working and accumulating hours and have all the estimated months at the end.
Aren't we talking about temporary people?
We are talking about your variable hour people only, those that you are not sure.
And they're not going to be working in that summer month either, probably.
And there's going to be, yeah, very probably no hours accumulated. She's got July done, that's why she wants that one.
There's substitute custodians as well as substitute teachers.
Yeah. There could be substitute custodian, cooks, everything. So then the other variable that ends up changing is your administrative period, your open enrollment period becomes a 90-day versus a 60-day. So do you think people would be more confused when at the end of the 12-month measurement period you tell them, which is going to be what? If we move to July, the end of our 12-month measurement period is June 30th when they're not at school. So you'd have to be take it a little while to see, okay, what were their numbers? And then you communicate to them, probably, no matter what, it's going to be October 1. Probably not a big deal one way or another there.
we're doing variable employees, like say the summertime custodian
we do the 9-month thing and then not have to go back and do that calculation of the average for the other 3 months and stick that in there? That seems like extra work to me.
But we have people though that work
But wouldn't they just be
in the summer, but they also do it during the year.
The question,
They come work full-time.
the question was, why can't we use a 9-month, 10-month measurement period and only track really the academic year? Because we're talking about the subs, the custodians, Rule 10 coaches, and so why are we even messing with the summer months?
Yeah, because then you have to go back and do that average and then go back and add that in, which like I said, just seems like extra work to me, so I don't understand.
I-
why we did the 12 versus the 9.
You're allowed to use different measurement periods for different classifications. Now, Brian really didn't go into which classifications you can use different measurement periods to, but the law says you can do it versus hourly versus salary. You can choose a different measurement period. You can do it collective bargain versus non-collective bargain. And there's a couple other odd ones. I think those are the only really two that are going to apply in this situation. So, yeah, I know. Going just to doing a 9-10 month measurement period isn't going to solve or make anything a whole lot easier. Yeah.
Mary was weighing in on, she was voting for office, and I asked her why, and she said that's because all employees started putting hours, including new ones, less spreadsheets to track, considered all contracts starting August 1st. I think it was kind of the same thought that you were.
That Rose had. It may be. We may have a difference more in service centers versus districts. And maybe we can have two separate based on that and let you pick and choose between one or the other. Because that, you know, that at least narrows our conversation a little bit. I know you should be, if this is the real life example, if you're 100 plus, you need to be doing this now. And if we move it back to July, then you'll have to backtrack. But this is a good time for you under 100 to be practicing, figuring out who those people are to determine if you're going to try to keep them under 30 or what you've got to work with. So I guess the message from right now, we'll run it by the committee when we meet next week and give it some further thought between now and then get you out a message as to whether we offer you a couple different options, whether we pick one versus the other. I'll give more thought to the payroll cycles.
If you're making your spreadsheet for monthly hours, August would have the hours you're paying in August. September would have the hours you're paying in September, and just have a running total for each month for each of you new variable people. Am I missing anything?
The only piece that I think you're missing is the fact that it doesn't match payroll. But if you, yeah, it may not matter. Right. Huh? Yeah. What you're getting paid, that's a different calculation. Okay. Okay. So then are you back to working on the first, now you're back to it doesn't really matter whether it's an August 1 or July 1.
No, not if what she said is going to be kosher, then no, I'm fine.
Yeah, if you're tracking every week, every day on a grid, it shouldn't matter what your payroll cycles are. That's a separate issue. Okay. Okay. Any more thoughts? Yes.
So what do people do for substitutes? We actually, I don't get hours worked by substitute teachers. And what we do is we pay either a half day or a full day. So payroll, myself, I'm given information from the building secretaries that says this person subbed 1 day or 2 days, or they subbed a half day. So do we just have to determine what is a half day and put that number of hours down?
Yes. What they're paid, not what they're paid for, not.
Paid for, right. Yeah.
Because it's what they're actually paid for, not the hours they actually worked. If you're paying them half a day, they worked less than half a day, you still have to report that.
Now, half a day is 4 hours a day, yes?
Yes. Okay.
So 4 hours a day at 5 days a week is how many hours a week?
Because our teaching contract, our negotiated agreement, a teacher's workday is 6.75 hours.
Start over.
Okay, so if we're working from our negotiated agreement with our teaching staff, their day is 6.75 hours. So if the substitute would be, a half day would be half of the 6.75 hours, correct?
How many hours do they have to be there? That's
No.
Yeah. I think it's going to, what I'd go back to is, at what point do you switch from half day to full day payment? Is it at 4 hours, 3.5 hours, 3 hours? And I think that's, if you're paying for a half day, I'd go to whatever that point is. It's like for us, anything up to 4 hours would be half a day. So if it's a half day sub, we're going to treat them as 4 hours. If it's a full day, we're going to treat them as 7 in our district, because that's how we define our day. The certified day is 7 hours. Yeah.
Wasn't I told at one point, if you don't actually have tracked hours, it's an 8-hour day? If you don't actually have it written down, the time they were in the building, you have to give them 8?
That is one of the allowances in the law, that if you cannot prove the number of hours they worked, you can use either the daily or the weekly equivalent, where 1 hour a day equals 8 hours a day. 1 hour of service equals 8 hours of service in the day, or 1 day a week equals a week's worth. So yes, it's what you just said.
So where they're talking about 6.75 times half, if they don't have that in writing, if they only work that many hours, don't they have to do 4? Or not?
But it is in writing. It's in our
Yeah,
negotiated agreement.
But I mean, the teacher isn't clocking them out.
Teachers don't clock in and out.
So then now the issue is clocking in and out, and how do you document and how do you prove how many hours they're doing?
Well, in our case, we keep a spreadsheet and it says a half day or how many periods or.
So she
Our
uses
building
a spreadsheet.
secretary keeps a spreadsheet. Our sub-secretary keeps a spreadsheet, because we're basically a single building. And she notes whether it's a half day or a full day or a period or whatever. So the documentation is there.
Do you have the employee sign off on that so they agree to those counting of hours?
No, but they get a copy of it with their paycheck. So if there was a question,
Okay.
they do have the information.
Okay. Anybody else want to chime in?
Is that what you're talking about, is a sub form?
Sub form.
The teacher fills out the request for a sub. I'm talking about the subs themselves and how we pay them.
And then they agree and they sign at the end.
Okay. So there,
It's not a form.
yeah.
They're going to talk about it at the meeting. Okay.
Documentation is going to be the key. We don't really know. We're just going to learn through this together. So when we communicate with you by email, we're copying everybody. So if you want to throw something out there, have the crowd respond to, feel free to.
So as soon as that we could add somebody new would be October 2015.
The soonest you can add somebody new is going to depend on what school district you're in. Because there are 4 districts who've asked for approval and are buying in newly eligible people. Otherwise, it will be at least the earliest of October 1 of 15. If you're not one of those special districts, do not extend your eligibility if you are not one of those few 4 districts. Thank you very much. I think we're done. Feel free to go.